Good afternoon to all. Good afternoon. My respects to the Chair, Justice Arun Mishra, Honorable Chairperson in HRC, the Co-Chair, Dr. Pratima Murthy Ma'am, Director Nimans, dignitaries on the dais and off the dais. Can I have my slides up, please? So, while I was invited to be one of the speakers and in this event, and I said to myself, there is something that I have to introduce. Amongst all you stalwarts, high-ranking officials, secretaries, professionals, I think there's a little that I need to introduce Cadabams and introduce Sandesh here. I'll just spend a minute here. Cadabams has been in existence for the last 30 years. We've run various mental health centers, facilities, programs. It ranges from preventive and promotive mental health, as Mind Talks. We have the hospital, the halfway houses, the addiction centers, now supported living as well. All of this started because it was a need within our family. So we actually are a family. The one that you see in there is my aunt, who did not get the help back in the late 90s of what the inspiration was. But what really shaped up, while that stood as our inspiration, what really stood up is the advent of professionals from day one in Cadabams. The first employee happened to be a licensed psychologist as Ms. Saraswati. To that of in 1997 to 2009, Dr. S.M. Channabaswana holding the fort as our medical director, and then there's been no looking back. So we've gone on to build various programs, build various facilities. Next slide, please. Today, we have the opportunity to operate our centers in Bangalore, in Hyderabad, and we're also partner service provider for the whole of the Maldives. Next slide, please. Coming into the theme of the challenges in MHCA implementation of MHCA 2017, I'll bring in a very honest perspective as a private mental health establishment to this gathering today and to this panel. I believe there's a lot many more private mental health establishment providers who are in there, who are delivering services in various forms out there in this country. I would like to give due credit to the Act. It's a very it's proactive. It's got the framework of one of the best around the world. We go back to any advanced countries around the world, this Act's very, very similar. So it's got the right framework. Now with, I have just highlighted the three key takeaways that to me are, what the Act stood out for is the mental health establishment. The recognition of mental health establishment and the functions of mental health establishment is rightly recognized in this Act, which is the clarity on the admission and how the admission procedure needs to be followed. The support system in rendering the services of mental health, though services like the MHRB, I'm sure it's in evolution. I did hear the co-panelists talk about certain restrictions and it needs to evolve, but I presume that there is a structure that is in place. I now like the fact that there is going to be audit of services and not just licenses that we have to go after. And finally, it gives us an opportunity to report everything that has happened in the month, in weeks, depending upon the scenarios that is, in the format such as, namely the restraints, the sectioning, and the minors admission. And it's been of a great boon for the patients who are informed, patients who are self-seeking for help. Their rights are codified. There is clarity to their advance directives and the nominated representatives. I do again recognize and emphasize the fact that it's an evolution. I mean, we will evolve. The Act has just come in, and I'm sure that will take place. ECT and the other aspects of the cases are more explicit and verbalized. To me, I also feel it is a clarity for the implementing agencies. There is systems, there is procedures. I will throw light on it as I go into the other slides as to where I see its prominence. Next slide, please. While it does help family and professionals, I want to bring out a few concerns and dwell into it as we go along in the other slides. It may come across as a bit of a repetition with respect to family, as it's been spoken at breadth by my other panelists. I personally believe the family is not recognized while they play an integral role in our country. Our social structures are still very intact. It's just not here. I believe so. It's around in any eastern part of anywhere in the east of this world. The family structures, they play a very important strength. And the Act somewhere does not give support to families who are wanting to help their loved ones to seek treatment. I assume with the state rules and the different modes and types of treatment being recognized and facilities, there is going to be some more clarity to this. But I did want to bring out this concern for this panel. Professionals. I think psychiatrists already did mention this, and I echo the similar views. Today, psychiatrists are made as the face of many aspects of the violation of this Act without actually providing them the support system. And this, the Act has probably taken away the confidence for the professionals to focus more clinically and then look at it mostly from the legal aspects, the documentation. It is quite challenging. And I could tell this with confidence because of my training in the UK, and I'd seen this in the early parts of 2008-9, working in NHS administrative roles. There is immense support given to the professionals where similar act is in place, where the professionals have a great support. And here, I feel the professionals are left to fend for themselves. So which should throw in some clarity as we go along. Next slide, please. I'm breaking down the implementation challenges. On my left, everything that I mentioned is a due recognition of the proactiveness of this Act. And it's a blessing to see psychiatric emergency being recognized in MHCA 2017. When we initially launched Psychiatric Emergency Helpline in Bangalore in 2017, we were questioned what is Psychiatric Emergency Helpline to what this really would mean. But to see it being recognized, it's a real blessing. But the challenge is, of course, is not everybody understands what psychiatric emergencies are, where you have to look back at the support of the police or the agencies. It's limited. So there's no organized support system. And 108 is truly ill-equipped to handle psychiatric emergencies, and we don't really expect them to be the forefront seekers. How have we mitigated this? We've mitigated this with PET. PET is our reference to psychiatric emergency team, which is a constitution of a psychiatrist who's the head of the treating team, with a clinical psychologist, psychiatric social worker, a psychologist, and an admin representative. We have the admin representative and the nurse to ensure that we have to do the documentation between the police stations because we are a private service provider. So this is how we have overcome these challenges, but as it gets defined, as many officials in the society are informed, I think there would be an ease. Mental health services is a recognition because the mental health establishment and mental health services, I presume, is going to be a positive. Like any other general healthcare sector, I think private mental health service providers is on the rise, and there is a significant contribution from the private mental health care service providers. The acts and the agencies we would like to see it a little more less restrictive and supportive as we go along. But there's always a need to collaborate across with partnerships and the governments. Next slide, please. Nominated representatives, I'm not going to dwell too detail because this has already been brought up. My reference here is family cannot be considered as a party with some sense of suspicion. Families do play an integral role. Families do need to be involved in the treatment as we go along, but today the nominated representatives does not explicitly mention it, but as there would be a need for clarity, especially for individuals with the acute and the subacute nature of illness. Next slide, please. Mental health review board is, here's again a personal experience being a member of the mental health review board in Karnataka for the Bangalore and the Mysore districts. Of course, today the scope of our board spans out into about 17 odd districts there, but there are appointments from multiple other mental health review boards. I feel I'll emphasize on the first point here. Understanding the roles and responsibilities of the board as in the Act is interpreted by individual boards differently. As we see we've been fortunate enough to be one of the first few boards to be set up as being part of Karnataka in India, but then the point is there is a need for formal training for the board. So there's this common interpretation and the common delivery of the service. I think the common checks and balances that could be in place. Next slide, please.
2 minutes.
Yes, ma'am. Here's the hope. I would say there is a need for continued care. There is emphasis to this. There is care beyond hospitals, and that is true. We have seen that in our halfway houses. We've seen that in the assisted living spaces. We've seen that in our community living spaces. The structured, less restrictive community living is going to be the way forward for certain individuals with different natures of illness. And in continued care, I would like to draw attention to the need for community order. The community order would play a critical role, especially for individuals where there's so much emphasis on community-based treatment. But if there is no guidelines of how these individuals have to live in the community, be compliant to medication, be primarily because of their insight or lack of insight, and the rest, we are only staring at a very difficult situation with more disability because of just the community-based treatments. The need for innovation in care, I'm a strong believer of the fact that there has to be something in between the custodial care to that of community homes, step down, skill enhancement, a community that houses, that gives people to explore what they wish, really not want to explore, just live along. I did not mention, but we're also in the due process of building homes where family members with the individuals can also live along. So, it's really about building communities. And finally, the last one, I really would look for help, and it's a request on behalf of every individual with mental health condition. There needs to be something done about the employment for these recovered individuals with mental health problems with certain sense of issues, because it's not easy to get jobs, it's not easy to place them and partner them. It's been an ongoing challenge. The next slide, please. One final reference here. The addiction and mental illness, the Act considers psychiatric illness in people with addictions on similar grounds. The issues to me are totally different. The requirement to, and the treatment approach, the recovery, reintegration for people with addictions is totally different from what it would be for persons with psychiatric illness. I would have loved to delve a little more into this. For paucity of time, I'm not going to do this, but I feel this is one area that we as private mental health establishments would need certain clarity, and we will, we're following in line with how it is being laid out right now, but as more clarity comes in, it's going to be only better. Next slide, please. As a personal personal experiences of stigma. I think stigma stays not only just for recovering individuals, it's also there for mental health professionals and people like us who deal and we work with mental health, in this field of mental health itself even today. So we've destigmatized it. I'll draw reference only to one of it, which is called Mind Talk. So we say Mind Talk is there in schools. With schools, what we've built in is a a school mental health curriculum which engages children from the younger age groups to first grade to the 12th grade and made emotional wellness a way of life. We've been able to pick up many more instances, situations which would have ideally not been picked up if it's just a counselor going into school. This is done in partnership with the CNTW Trust of the NHS UK, who's a nodal agency for the school curriculums there. And we do have events, so we open it up for mental health and LGBTQ, mental health and music, mental health and movies. These are communities that we're building within the society where they feel therapy treatment is a lot more accessible. Thank you very much for your kind attention. Thank you.